Hi, I'm Dr. Jonathan Burtman, a family physician and the Chief Medical Officer at MTBC. Today we're going to talk about incorporating telehealth and telemedicine into your practice. It's curious that despite all the technology pervading our lives today, that it's so difficult to be in touch with your patients. And they with you. They have to frequently call the office, make appointments. Things are designed that way because reimbursement has been designed to require a face-to-face visit of various complexity. Now, we've talked in the past, and we'll talk more as these laws become updated and go to the various states and local and third-party insurers, but the laws for reimbursement are allowing telemedicine to come forward, and that will open the door to the sort of communication that I think most of us enjoy with our family and friends and colleagues today. Things like texting, maybe FaceTime, and conferences remotely. All of these things are fairly easily done today in all aspects except for healthcare. Now, of course, one of the reasons is that HIPAA requirements puts healthcare at a different level than just regular communications. And since once personal health information is released, it can't be retracted. So it's a significant deal to air and release somebody's information. So the HIPAA requirements have made the adoption of our usual technologies somewhat slower in the medical field. But if we think for a minute about the perfect setting, or the perfect sort of design, it would be that if I'm a patient and I don't feel well, I get on my phone and I click my doctor, and then boom, I can either connect with them immediately in real time or whoever is covering them, or I can say, hey, I'd like to speak with you and set up an appointment for the first available appointment. And maybe that discussion is just like, hey, I've not been feeling well for a few days. What do you suggest? Or, hey, whatever it is. The point is, I think we all know that most visits could probably be managed with a phone call, a face-to-face call to really get a sense of what that person is saying and feeling. And we would be doing that if it was reimbursed. And so as reimbursement is quickly brought to the same sort of parity for telemedicine, and we'll keep you up to date on that information. But as that happens, we will start to see this come into our practices. And that will be because patients demand it. So once it's available, they'll want it. Now, that said, there are a number of services today, and you can become a telemedicine physician and sign up with a practice and sort of become one of their employees and sort of work for them. That's available. You can moonlight today. There are available options based on your licensing and things like that. But in terms of incorporating this into our own practices, that really requires our EHR to support this. And it makes sense. I mean, all of the patient's records are present on the EHR. All of the patient's past history, the things that make continuity of care so important are all available on your EHR. So having access to the patient through there and having it come directly into the system is obviously necessary to really enjoy the benefits of this. So then, how do we reap the benefits of this technology with the requirements of HIPAA, meaning we can't use FaceTime, we can't use modalities that are not HIPAA compliant, and frankly, it's difficult to even figure out what is and is not HIPAA compliant. So we are left trusting our healthcare provider and thus need some sort of a certified solution to ensure we're truly compliant with HIPAA requirements. So So now the next question is, well, how do we connect with our EHR? And over the years, all of our EHRs have developed PHRs, or personal or patient health records. And the PHR side of things really is the means by which we need to connect with our patients. And some PHRs are more robust than others. Some have telemedicine face-to-face and other features. Some are building them. But it's clear that they will all need them, and they will all need to include these face-to-face abilities as reimbursement allows it, and as both patients and practices suddenly realize the unbelievable benefits and efficiencies to use telemedicine in this manner. So the key really becomes getting patients to use the patient health record side of things. And we know that's not completely easy because most of the time it relies on making patients log into a certain thing and jumping through hoops. And frankly, most of us know that that's very difficult for many patients. And it's really only the more technologically competent that will use them. And otherwise, our patients just won't use them, and we really won't reap the benefits until there's a way for our patients to pop open a button on their phone and connect with us. So that's clearly where our company and many others are working. So our PHR side and many of these PHRs, and you should check your own EHR if you're not using MTBCs, but many of these systems will allow you to connect through your phone, open the app, and be able to ask for a refill of medicines, connect with a doctor, connect and set up an appointment both for a face-to-face real visit in real time, in real space versus a remote visit. So opening your PHR or having your patient open it and start to use it really is kind of the big barrier here. Trying to get your patient to say, okay, I'm going to try this, becomes the first big step if you want to start to practice telemedicine. So onboarding your patients to your PHR is step one. So how do we do it? The first step is, of course, that we need to have the patients sign up to be on there. And most EHRs have the means to enter a patient's email or cell phone number and send that patient an invitation. And that patient will then authenticate themselves through their phone the way we commonly do and have their PHR to the clinician's EHR connection made. That's step one. How do you encourage patients to do that? I mean, you certainly can give them instructions. You can have your labs and other information posted up there, things that get them on there. But most of us know that patients are not really that interested in doing that. We have to give them some incentive. And if we really want to incorporate telemedicine into our practices, then we have to incentivize them to use our service when they need the service and not make them do something that they otherwise would not do. So, for example, it makes sense to get patients on board by offering them at one visit the chance to follow up something that generally just doesn't need a hands-on examination, to have their follow-up visit done through telehealth. And if they agree, you'll have the staff and everyone will set everything up so it works. And depending on your EHR, that's easier or harder. And of course, you want something that's easier for the patient to set up without needing any input from humans. So you might be following up someone for their cholesterol levels, and you could say, why don't you get your labs done, and then we will have a remote face-to-face, a telemedicine visit to go over these. Now, obviously, that will have to be a reimbursable visit before we really start to do this all the time and for any good reason. But once it is, and some states are allowing that to be, and many more as 2020 comes to fruition. But in any case, giving that choice to patients, some of them are going to say yes. And as some of these patients start to use it, and you start to use it to go over the results and make recommendations, because you really probably don't need an exam there, that's the way that people will realize, wow, that's easy. I didn't have to get down to the doctors. And the staff might also start realizing, wow, the office isn't as full with patients who are in and out just because this is how it has to be done for reimbursement's sake. So that's one alternative for your long-term patients you like and trust, and or whatever patients you want to try this with. I think you'll find that's a nice way to let everyone experience this in a non-threatening manner, or at a time when someone is not feeling well. But feeling well is sort of the next big one, and frankly, that's the reason that many people want to speak with their doctors on weekends and after hours. And there is a way to manage telemedicine so that you can put aside times where you will be doing calls, and you let patients know that these are times where you can call in with your concerns, and we can decide, do I need to see you this week, or do I need to follow up with you this week, either through this sort of a visit, or are you okay and you should take a few acetaminophen and call me in the morning, kind of thing, or rather set up a appointment and telemed visit with me in the morning, and I can look at you and you can look at me, and I can see how you're feeling, not only through your words but through your gestures and your face. And that's why telemedicine does need to be reimbursed, similar to face-to-face visits, because we gather so much more data than just with sight than just with sound and voice. So let's talk a minute about telephone care. And we do a lot of telephone care, unreimbursed phone care, in fact. And I would say that much of it, or a good portion of it, is certainly not evidence-based care. We're prescribing a lot of antibiotics, a lot of refills, a lot of things that perhaps we would want to spend some time knowing more about the details if we felt that there was a means to do so. But I think the reality is we often will get a call, or can get a call, and might do the less reasonable thing and end up writing for prescriptions for unnecessary antibiotics. And that doesn't even bring into account treating pain and anxiety and all these other things that probably deserve something more than just a phone call. And in this realm, telemedicine can also play a very large part, and can also be a means by which you begin to incorporate this into your practice. So, for example, if a patient does feel that they have that same sinus infection they get every time this year, and they've had it for 2 days and they need their Zithromax, well, one thing is, rather we can say, well, why don't you at least first see the doctor through telemedicine and talk about it. Or you can set up an appointment and come in, because the doctor doesn't prescribe antibiotics or opioids over the telephone. That's the rule. Telemedicine, possibly. Telephone, no. So that one barrier that frankly is reasonable to put in place for the benefit of patients and clinicians seems like a possible reasonable step. So somebody feels they want that antibiotic, they call in every year, we've been prescribing it, or some of us have, and now we can at least see them, have some time face-to-face to educate, you know what, let's give this a little bit of time. What are your symptoms? Confirm nothing's crazy, but let's give this some time, because 2 days doth not a sinus infection make. So I think if we are able to do that and use telemedicine, and telemedicine is being reimbursed, it's win-win. And patients aren't coming into a waiting room where there are sick people, and doctors aren't filling up their schedule with people who just need some reassurance and guidance on using a neti pot or other evidence-based treatments. And getting these people onto telemedicine and seeing them through your telemedicine EHR portal is then the next step. And the way that occurs is the patient gets on their phone or mobile device or computer and installs the PHR if not already installed and connects. And so that leads to a few issues or concepts, which is one should have some time in their schedule that's really earmarked for telemedicine appointments. And at first it's going to be quiet. And once this takes hold, you'll get more and more of those, and you'll have less and less office visits, hopefully. And those office visits that occur really will be the necessary ones that you need to really examine and be with. And the other issue that it brings up is really that you need to have your staff on board with this whole concept, and because really it is the staff. Staff are the ones who are going to have to deal with all of the patients saying, wait a minute, you gave me this treatment last year, what's changed? What's changed is we have better technology so we can better fine-tune your care. And while you think you may need the Zithromax right now, you might, but let's at least let you speak face-to-face with the doctor, talk about what's going on, and make a more reasonable assessment because that's better care for all and the population at large. And if not for anything else, most of our reimbursements are getting more and more tied year after year to our merits and our quality-based care. So if I'm prescribing a lot of antibiotics compared to my colleagues, that will end up with decreased reimbursement. So if it's a money issue rather than a practice good care issue, whatever it is, it's win-win-win. So it's time to start to implement the technology that we have at our disposal to provide better care. So this takes changes and staff buy-in, and that is generally the challenging part for practices to truly dive into this. But I think if I were starting a new practice now, or if I was ready to completely dive in, my goal would be to set up in my EHR, my schedule, the telehealth times where I'm just taking telehealth appointments. And I would set those up either a little bit every day or one or another day, or I'd start to set up sometimes. And at first, I guess I'd take a little bit every day, especially maybe on Monday morning, and really try and set up a practice where I'm spending Monday mornings figuring out and triaging the patients who want to see me and putting them in for Monday afternoon and Tuesday morning. And the later parts of the week would be scheduled with follow-ups and new patients and other things like that. But for telemedicine, we could be doing almost urgent sick visits, triaging what you need to see, what you don't need to see, compensated for it all when reimbursement hits parity. And again, we're getting close in some areas, and we'll keep you abreast of that, and most EHR companies will. So that's how I'd sort of incorporate it with your scheduling system in your EHR. The other thing is with the staff. They have to also see the benefit of this, and they will immediately when their phone calls and other call-ins that are currently the way practices go decrease, and patients are connecting through setting up appointments for that day, later that day, to speak with the clinician, and that's all can be automated through the EHR with reminders set, and at that point the staff will be thrilled. But The issue initially is how do you get these patients on board? So the easier your EHR's system or the patient portal side of your EHR or the PHR, the patient health record, however easy that is for the patient to download or get on board through a link sent to them will certainly make it easier or harder for your staff, who generally will be stuck having to walk these people through it. And, patients don't have a high tolerance for a lot of technology craziness, especially if they're not sure if that it's really going to help them. And I'm sure many of them, and which is one reason why telemedicine has not been as widely adopted as you'd think based on the valuations of many telehealth companies. But patients are not really adopting this yet. They are not yet understanding the full benefit of this. They will when they realize they don't have to see their doctors as much or get to the office, because really not a lot of our patients, the majority of people don't enjoy coming to the office. I suspect there is some amount of our patients who need to see us, physically see us on a regular basis. But there are also plenty of patients who can be seen regularly, remotely, and connected with under the less common and more serious circumstances. So to summarize, I think in terms of bringing telemedicine into your own practice today, there are a couple key concepts, takeaway messages rather, that I would say. And they are, one, you have to have the ability for your patient to easily get onto the patient health record side of things and become comfortable with it. And depending on your EHR, that will be easier or harder. The instructions to do so will be easier or harder. Ideally, they'll get a link through their text message once they agree to participate, which is, generally in the EHR, there's an area you can click and turn on and send them a message, and they can log in and be signed up. So you want just an easy process, get the patient there and ready, and then either you need to entice them with some cool information on there, maybe a newsletter from your practice, maybe an announcement that they're notified that, flu shots are available, so come on in. There are many ways that happens now, but this is a cool way to get them to start using the portal, becoming comfortable opening the portal. But getting on board is the key step. And then the next key step is really setting some policies in your practice that certain things that we really don't like to do on the telephone, we're going to start to do through telemedicine. And perhaps we're going to do it even if it's not reimbursed initially, because it's really fairly uncool to be doing it over the phone. So this way we can sort of deal with two issues. The difficult call-ins that we really don't want to prescribe a certain medicine but are getting tremendous pressure, and the face-to-face ability to explain it and work out some compromise or plan that's in the best interest of the patient. And so setting up those policies, getting staff to be a part of them and help the staff also realize that this is what they want would be a very useful and an encouraging step. And talking about how telemedicine, the goal here is to make the practice easier, to make the day-to-day easier, not harder. So if it's getting harder, well, that's the wrong path. If it's getting easier, then you're on the right path. And I think once the staff starts to realize the true benefits of this, once clinicians start to realize the true benefits of this, and once patients realize the true benefits of, wow, I don't have to go to the doctor's office, I can do this, yeah, I'll schedule it for tomorrow or the next day, no worries, because I know I'll be able to see the doc face to face and get my concerns addressed. That is sort of the time where telemedicine will explode. And right now we're at the early adopting phase of this, but it's coming, and it's coming like a wave. So I'm John Bertman. Thanks again for listening. I appreciate your attention, and we'll take some questions that we'll respond to the group as a whole. I believe Seth is going to speak to that.